Hello, everyone, and welcome to this live session. A warm welcome to you all for joining us today on behalf of the entire team Marrow, the people that you can see on the screen, and the extremely hardworking crew backstage. I welcome you all to the world of medicine. Uh, this is the beginning of your journey, and here we are as your mentor in your first year to guide you through all your ups and downs, to prepare you for the challenges, to help you navigate through the do's and don'ts, and to share the recommendation that we can try to make your journey as smoother and meaningful as we could. I am Dr. Ashwani Kumar. I'm a faculty of human anatomy, and I've been teaching wonderful people like you for 2 decades. That sounds, yeah, that makes me look quite old, but yeah, first year faculties are never old. And before we go dig deeper into this conversation, let me take this honor to introduce our esteemed faculty from physiology and biochemistry as well. Well, over to you, sir.
Hello guys, hope you're doing good. This is your physiology faculty, Dr. Krishna Kumar. On behalf of Marrow, I wholeheartedly welcome you guys to this live session. We'll be live here for around 45 minutes to 1 hour. So we'll address your queries and some general guidelines on what to follow regarding particularly the Marrow for first years. I once again welcome you guys. A warm welcome to all of you.
Hello everyone, I'm Dr. Rebecca James, biochemistry faculty. I'm working in a medical college for the last 15 years and I'm with the students and I love teaching and I'll always love to be with you as one among you. So we shall proceed to what about the first steps in your MBBS curriculum. So I all know that that you have cracked NEET 2025. It was not so easy exam. I think that was the toughest exam the nation has ever witnessed. So you are all here means that you are the cream of the society and at the same time you are the excellent brains. So for that, we all congratulate you for cracking this toughest exam and be here. So let me just guess what is in your mind now. I know that till now you had a prescribed textbook, an NCRT textbook for physics, biology, and chemistry. But now you are having an ocean of textbook for each and every subject. And every textbook is having something to you as well. But you are totally in a confused state from which textbook I should study, what to study in everything. So you are not in a streamlined and you are totally in a chaos situation now. I can understand. Apart from that, all the portions, anatomy, physiology, biochemistry, everything, all the teachers are taking so many topics every day and it is going in a supersonic speed. Not able to finish your daily lessons. Maybe your first exam has been over for you. And for the first time in your life, you might have failed for one exam also, I'm sure. Or just to pass. You are all, till now you got 90%, 95%. Now I know that once one exam is over, then most probably it is 50%, 40% like that. So you don't know what to do. So the first steps in MBBS is like the toughest time that everybody faced. I faced such challenges. When I joined medical college, I joined late. So every subject is already taken in the college. So I think that if you have joined early, then you are in a better situation than me. So I want to assure you that, if people like us can crack this and come to this level, then definitely you can go to greatest heights than me or than each one of us. So my thing is, first thing I want to tell you is that you should believe in yourself. The first step is always the hardest step that you have to take in every courses. So this is also not yet another course. So definitely this step is the hardest step. So my advice to you is that believe in yourself, tap on your shoulders and say that I can do this. Then you have to make some realistic goals. That is very, very important. One of the toppers in university, he has shared this experience to me, the feedback to me, that how he handled that first day stress. He is not able to finish all the topics on the same day. But what he said to me is that at least finish anatomy on the same day. The reason he says that, anatomy is subject that you see on that day, so you will forget very soon. So before it is evaporated from your brain, please study anatomy on the same day. Then what about physiology and biochemistry? If you have time, you finish on the same day. If you don't have time, the realistic goal that you can make is at least finish physiology and biochemistry topic within that week itself. Within 3 days is what I will say, because there is a curve called as forget curve. So if your first learning should be as early as possible. So at least within that week you finish biochemistry and physiology, and that's how you can make a realistic goal. So this is what I want to tell you. First step is always the difficult step, but definitely you will get through this and you will come out with flying colors. That is what I want to assure you.
Well, thank you, ma'am.
Yes, switching over to the first year course in Marrow, I think Dr. KK sir, Krishna Kumar sir will highlight you with regard about how to switch to first year course in
Yeah.
Marrow.
Yes. Thanks so much for your wonderful insight, ma'am. It's very simple, guys. If you have the Marrow app, just navigate to menu on the top left corner, go to your courses, top left corner, go to your courses, where you will definitely see Marrow for first year students. I think most of you already have this. So if you click on that, your Marrow first year course will be selected. Then you will automatically land upon the subject wise videos. Yes, sir. Please go to the next one. Yeah. I'm your physiology faculty, Dr. S. Krishna Kumar. In Marrow, when they gave me the poster regarding this live session, when I posted in Instagram, Facebook, WhatsApp, everywhere, the first question that came to me is obviously from your seniors. And they told me, sir, we don't got any live sessions like that. We don't got any guidance sessions like this, sir. So I think me, sir, madam, everyone will universally accept that this is the golden period for learning, and this generation is considered to be the golden generation because of the enormity of availability of resources. Fortunately, I am on one side here along with you guys. I am also going to this golden period for learning. You're all learning here. Particularly for physiology, we added many videos this time. Physiology, particularly this Marrow videos, you can take definitely as a sole source for your preparation. If you look into your previous question papers, 99% of questions will be definitely covered in these videos. That's how I told myself. I prepared these videos first for concept clarity. Then you should definitely use them as a sole source for your university exams to write your answers. So definitely you can use them. You can watch them, take notes, and reinforce those notes through revision and write them in your exam paper. You'll surely get good marks with concept clarity. With that, I'll switch over to the next subject.
So let me take care of this anatomy part. Well, as sir already have told you how to switch into the app and find where these videos are. And again, you can see on the top of the page, when you open the subject wise app, you can see the new subject which are being added. So there are approximately 50 videos added in the anatomy, and most of them are the cadaveric dissection videos, which we will talk about a little later. I have just, apart from what sir told you, I have just few recommendation while watching the anatomy videos, is that make sure that you start with the general part. I have seen that people generally, because looking at what is going in their college, they directly try to switch to that area. And every faculty is having their own way to make your concept and align them in a particular way, and so do we. And that's why I want you to watch the initial videos, like introduction to anatomy, the skeletal system, the joints, the muscles, the skin, fascias. So all the basic general anatomy videos first, and then you can definitely follow the sequence which is recommended to you or which is going on in your college. So in most of the colleges, they start with the upper limb, but I know that in some colleges they start with the lower limb or the other portion as well. So that won't be a problem. But the thing is, if you don't know the ABCD of the subject, then how are you going to learn the language? So it's very important to understand this general the part. And believing that we are in the month of November, so I believe that general anatomy is probably over in most of the colleges, or it is going on. So I would say that even if you're done with that, to have a connect with us, to have a to understand that how our approach will be, I would very strongly recommend you to watch the general section first, and then you can switch on to the systemic videos accordingly. One more thing, that on the top right corner there is an index, because when you look at all these videos, they're numbered as 1, 2, 3, 4, 5, like this. Those are hundreds of videos are there. So you can directly go to the index section, you can go to the specific unit you want, and then you have those videos aligned in front of you, and you can start watching them as per your convenience. Ma'am, over to you.
So, with regard to biochemistry, I should say that applied learning is the key. It is not only for biochemistry. All faculties will agree with me that now, once the CBME has implemented, applied learning is the key. So, with regard to biochemistry, I should say that to find out how to find this applied learning is not possible in the first learning. So that is one thing that we should understand. So when the classes are taken to you in biochemistry, in videos also, in the classes also, we'll always go from chemistry, metabolism, and to the applied biochemistry. But once when you go for any exam, then you have to take the applied biochemistry to the top, which is not possible for you in the first learning. So once you have completed any subject, what you can do is that you can write on the top that what are the applied aspects here. For example, if I'm saying about carbohydrate metabolism, then in carbohydrate metabolism, glycogen storage disorder is an applied aspect. Then another applied question is very commonly asked as the diabetes. So diabetes is an applied aspect. So when you are preparing for your exam, now that cycles, pathways, and all those things which you think is the biochemistry is now not asked. What they are asking is only the applied aspect. So this is what I want to tell you. First learning you take in the bottom to top approach, but once you have completed biochemistry, you have to take a top down approach. This is one thing what I want to tell you to learn biochemistry. Second thing is that you have to prioritize the topic. This is very, very, very important. So how to prioritize the topic, that is number one that you have to do is every university has published previous year questions. Every university site it is available, so you have to download it. Plus you have to download one more document, that is the curriculum or the syllabus from your university site or from NMC. Both sites you will get the curriculum that you have to follow. These two documents you should be having. Then what you can do is see the previous year questions, see the statistics of it, how frequently those questions are coming. So based on that, you can prioritize the topic. For example, if I say in carbohydrate metabolism, diabetes mellitus is the very frequently asked question. It is not glycolysis, it is not gluconeogenesis or anything which you are learning like chemistry, isomerism. It is not asked. So first thing is that you have to find out what you should learn in every topic. That is very easy. The faculties will definitely help you. In videos also, I am saying in the beginning, I am saying what are the questions that you can get. So based on that, prioritize the topic and then you have to learn. This is the approach that you have to take in case of biochemistry and in fact all the subjects. Yes. Yes.
All right, guys. Next, actually, in the main page of your Marrow for first years, you actually see this QBank, question bank. First thing, according to me, this question bank is to teach you, not to test you. Okay. Question bank is to teach you, not to test you. Then what are the tests, sir? Mini test, grand test, examination, internal assessment examination, university examination. These are your examinations. But this is a question bank. So it is not a test. It is going to teach you. And particularly regarding this question bank, what is the most important thing? You watch videos, correct? Knowledge comes from videos, but wisdom comes from question bank. Having the concept is fine, but applying them is most important. To apply these concepts, we actually devised this question banks. Second, if you do this question banks, in the particular question, there will be timer that is shrinking. What is the essence of that? Why we keep that? Because it is telling us to choose the correct answer under pressure. So in real life also, particularly being a doctor, Under pressure, you have to choose a lot of important decisions. For that, you will keep that timer there. All you utilize to your fullest. You see a lot of MCQs there. What is this MCQ? According to me, MCQ means mastering concepts through questions. That is MCQ, mastering concepts through questions. So always utilize this QBank to the fullest, because in your university exam also, there are a lot of MCQs, particularly it is having a mark system is there. So please utilize this question bank to the fullest. Next, sir. Automatically, the next most important thing is pearls. What is the essence behind this pearls, sir? They are your pocket-sized teachers. That's pearls. So when to start this pearls? Immediately at the end of this live session, please take one pearls to revise that pearls. Okay. The simple thing regarding this pearls is it is always about the high yield stuffs. So in exams, they will always ask you about this high yield stuffs. So this pearls is about that high yield stuff. Small capsule like high yield stuffs. On the go, wherever you go, you can easily take it and revise it. So big chunks are made into small concept enriched capsules. So these are the importance of these pearls. So not an ideal time to start a pearl. Even now, at any point of time, take one pearl and revise. They are very high yield. So QBank, pearls, they should ideally supplement your videos to enrich your concepts. Yes.
Yes, with regard to the practical module, actually 141 modules of practicals has been added in Marrow this year onwards. It is like an enchanting module that they have done, because we are all professional course, we are all doing a professional course. You know that in professional course, practical and clinical examination is the most important thing that is a part, which is a part of the exam, not the theory exam. Rather than theory, the practical and the clinical aspect is having more weightage, especially in the new curriculum also. So what this is actually a set of spotters and the high yield topic and image based questions which you can get for your spotting exam, your chart, Viva examination and OSPI examination as well. So this will be it will be of huge help for you. And how to get into this module is that once you enter into the home page of this first year Marrow edition, you can see a topmost, you can see this practical session on the top. So you just click on this and then you can get 3 subjects and you can select. Once you go to every subject, it is again divided into different topics. So based on what topics you are being guided through in the college, you can just go through it and see how useful it is for you. So that is about the practical session or the module that has been added. And over to Dr. Ashwani sir to describe the world's first thing that ever has been added in an app. Yes.
Thank you, ma'am. Well, even I'm excited like a kid about these cadaver dissection videos. Not only now when I'm introducing in them, obviously when I was making these videos. Well, nobody can deny the enormity of the subject of anatomy, and there's so much to remember, so much to learn, and as they usually say in anatomy, that's the seeing is believing. So in your first year curriculum, there is a huge chunk of your first year which is dedicated to the dissection. You almost have dissection almost 5 days a week or 4 days a week, and dissection hours are generally 2 hours per day. And you can imagine that how much time the curriculum is dedicated toward the dissection. And as we all know that the number of students in colleges, number of students allotted to a particular table, the kind of cadaver that we get, dissection, maybe not enough time available for the resident to dissect open the structures meticulously and show you everything. So the thing which is probably the most important is not serving the way it should. And this is where these cadaveric dissection videos are definitely going to be a game changer. And I want to tell you that, guys, these are not the pre-dissected videos. These are not the specimen on which we're discussing. I feel very fortunate that we got a chance to dissect the whole body from head to toe. And I've tried to dissect every single structure and explain them then and there itself on the fresh cadaveric dissection videos. And the team has done a wonderful job in creating such a meaningful videos out of it. For example, when you watch any cadaveric videos, and I would say that whatever topic is being discussed in your college, please try to watch the dissection videos on the very same day. As ma'am told you that anatomy is something need to be revised on the same day itself. And I'm sure that this will increase your confidence in class also. I mean, you will not be one of those people who are hiding behind and do not want to have a eye contact with teacher, because they might ask you some questions. You probably want to be the one on the faculty will be pointing when you are, who doesn't want to make an impression in first year, right? So you definitely want to be in that category. So these videos are definitely going to play a great role. And what you will see in these videos are that how the incisions are made, how exactly the structure are being opened. And the best part is because we got to dissect them ourselves and shoot them. So we have basically gone from superficial deep in every part. For example, if you're dissecting the arm, so we have started from the skin and the fascias and the muscles, and we've reached to the deepest structure possible. And then we have organized these videos in such a way that when you watch them, there's a particular sequence to that. Moreover, whenever you open any video on the dissection section, you will see that there is a body map on the side which will keep on guiding you that what is superior, inferior, lateral, medial. I hope you're aware of these terms by now. And there are also some reference images will be there. For example, if you're dissecting the axilla or the arm or the forearm region, so there are atlas pictures, reference images will be there on the side, so that you can see how actually it looks like in the actual human body, and how it does look like in a schematic picture or an atlas image. And the best part is that whatever is being narrated, every important structure is being marked there by the team. And I'm pretty sure that you open any one video and you're going to enjoy that. So this is one of the I would say one of my dream project. And I would say that 2025 batch is the one who probably is going to utilize it. And I'm pretty sure that you're gonna like that part. So I would very, very strongly recommend you to watch these cadaveric dissection videos right from the beginning, and obviously according to the unit which is going on in your college. Ma'am, some questions. We did some survey, and there are some frequently asked questions, and based on that, the team has collected some questions which are like asked by the mass, and I want you to just address few of them. So please, could you start with the first one?
So, the primary focus in the first year, I will say that it is to build a strong foundation. You all have seen how a house is being built. So, thus, what you are seeing on the top, or what you have seen a doctor to be, is somebody who is holding the steps and going to the wards and treating the patient. This is your dream, and this is what you have seen as a doctor. But always remember that is the tip of the iceberg. So what is underneath is the first year and the second year subjects. That is what making you the best doctor to make the correct decision every time. So first year and second year, I should say that the primary focus is to build a strong foundation. And even in NEET PG exam, I will say that whoever is strong in their first year and second year subject is unshakable. All the toppers will agree with me that the top rankers are those who are strong in first year and second year subjects, not in the clinical subjects. Yes, it is only the outside. So this is what I want to tell you: make a strong foundation in the first year. That is what I want to tell you. Then another myth I will tell you. See, their university topper last year, if you have seen any university topper last year in the MBBS exam, you have a thought that they have learned everything from page 1 to the page 100. No, it is not possible. And there is no a single textbook to learn from page 1 to page 100 also. So how you can learn is that you have to find out what to learn. So this is about how to manage the time. Smart learning is the way to manage the time. I will say some tips that I have used during my MBBS years. What I do is that I divide the time that you are getting for studying into three different segments. So the first segment is like when you are just back after the colleges, tired after the college and all. Don't dedicate the time for something to learn anything new or something for the exam, etc. No. If you have some writing works like record writing, logbook writing, or diagram book, so such things you can do in the first segment. The second segment is to at least go through what you have learned in the same day. Like, especially, I'll say dedicate the first priority to anatomy, because anatomy is something that you have seen on that day. Learn at least once that day itself. And if you have time, please learn biochemistry and physiology also on the same day, at least within that week. So that is the second segment. The third segment is the good time that you are having. For example, I used to wake up early in the morning, like 2 a.m. I wake up. I go to bed very early, but I wake up very early, like 2 a.m. because I always know I was a hostler. Poor me was a hostler. Most of you are away from home now, living in hostels. So this is the time that, you will never get a quiet time to study. And I never like to study in that noisy environment, and I like to read loud. So other students, other people don't like me if I read aloud. The other people not like it. So definitely, what I choose the time that I choose to learn is the 2 a.m. 2 a.m. I wake up and I learn. Then usually nobody, everybody in good sleep, and then that is the time that I choose to learn whatever is for the exam or backlogs, etc. That time I dedicate. So from 2 a.m. to 5 a.m. or something, like, to that time, if you learn, I'm pretty sure that you'll finish very fast. 3 hours is enough. Then you go to sleep, you take a short nap, and then you wake up early in the morning, like the 7 a.m. or something, because you have classes at 8 a.m., right? So 7 a.m. Till 6:30 or 7 a.m. you sleep, then you wake up and go to the class. You will see the difference. Okay, so this is a simple technique that I have used to manage my time. So dedicate rigorous routine, and dedication is must for any exam, and not only for exam, for any professional course, which include MBBS course as well. So this is what I want to tell you with regard to primary focus. So Ashni sir and KK sir, if you have anything to add on that.
Well
Ma'am,
done, ma'am. Nicely told.
well, ma'am, I just have to say that the only reason you're able to study at 2 a.m. because people like me and Dr. Krishna were sleeping at 2 a.m. for sure. So that's why you were able to study in peace, because you had a session from 2 a.m. to 5 a.m. Then you're still able to wake up at 7 a.m. Like, hats off to you. Because if you sleep at, in boys hostel, and probably people will agree with me, we don't sleep till 2 a.m. Okay, we'll sleep only after 2 a.m. only. So we just wake up half an hour before the lecture only. Well, we're not recommending this, but that's what the truth. That's what we did. Uh,
Correct, correct. Yes.
Sir, could you please
Yes,
take this
yes, yes.
question, please?
Now, this is another very, very common question, friends. How should I approach my first internal exam and prepare effectively for it? My first internals didn't go well, so how can I improve from here? See, guys, first, very basic thing. Why people in authority administration, they kept something as internal assessment exam? Because the portion is very huge, very vast. We will not straight away put you directly in the university examination. For this, we devised small cyclical modules that are internal assessment, so that you can do well on this small assessments, so that in the final end, you can collectively revise them all and write the answer. Internal assessment is never about the marks, it is about the mastery. What is the meaning of that, sir? Planning, strategy, how to present my answer, where all I am lacking, time management, extremely important. If you ask your seniors, they will always tell you this one important point. I know everything, but I don't have the time to write this answer. You should never get into that point. For that, all this internal assessment are always considered to be a rehearsal. So master your time, try to present your answers very well. Presentations, concentrate more on the presentation part rather than marks. Always please try to master this internal assessment, effective time management. Second important thing, obviously, even the one who got the university exam gold medal in the past, if you see them, the first internal mark is always their lowest. That is for sure. For everybody, the first internal mark is always going to be the lowest. You will definitely will have low mark. We will grow from that. Don't groan. Please grow from that. You sculpt yourself. So always use this internal assessment. They will definitely tell you in advance this internal exam dates. So please plan accordingly. Don't keep everything in the last moment. Small chunks, daily study. And in the main, particularly in the internal exam, Please use that for strategy management, how to present the answer effectively in that given time duration. This is according to me. Maybe faculties can give their input on this.
Well, sir, you have already told the important part of it. I would say that the one of another reason that people fail in the first internal exam is not just because the enormity of the subject, is also because knowing something is different and then representing it is different. So how you structure your answer, because by the first internal examination we are just learning that, okay, whatever we read in the textbook, whatever lectures we attended, how to represent them in a perfect answer, where in the limited words we can express everything. For example, in the subject like anatomy, I mean, you cannot deny the importance of diagram. If you don't draw it, you won't get a mark. So it doesn't matter whatever the question is asked, whether they are pointing out, draw the diagram for it or not, but you have to draw it. If you don't write the clinical aspect of that particular topic which is being asked in the exam, then you will lose the marks on this. So it's very important that the setback that we have in the first internal examination, it is not a setback, it is actually a, you're taking two steps back to leap forward. And the reason is because you're learning that how to structure your answers, how much to as ma'am told in the beginning, that it's important to not to know, to read everything but not to know everything. I mean, for the examination, obviously you have to have a little tunnel vision and you need to focus on certain areas, and the structuring your answers, and that we will be talking about in the upcoming questions also. So I would say that what sir have told you, I would additionally say that the one other reason the people fail in the exam is that despite of knowing the topic, they're not able to represent the answer meticulously in the exam.
Yes, we can go to the next question, sir. Yes.
How should I approach the standard textbook and study material? Let me just give you a little recommendation from the anatomy part, and then I'll ask sir and ma'am to put light on it. Well, there are so many textbooks available nowadays, and there's a difference between the textbook that you are generally asked to read and the reference book. Now, sometime in the flow of things, you will hear your seniors or maybe your professors recommending you some books like Gray's Anatomy and all those Keith and Moore. Well, they're wonderful book, no doubt about that. But uh, looking at the practical part of it, there are certain textbook which you have to which will be your buddy throughout your first year. And in the current scenario, I would say in anatomy, probably the Vishram Singh is topping that list. Although if you're using the BD Chaurasia, that is still okay. We all read BD Chaurasia in our time. That was the only book we all read. And but nowadays, if I look at the language, the how the book is structured, probably Vishram Singh is the one which is probably one of the best book available. And for the gross anatomy, the volume 1, volume 2, volume 3. General anatomy you can read from any book, and general anatomy you can read BD Chaurasia, Vishram Singh, or IB Singh. There are so many general anatomy books available. uh, Histology, I mean, honestly, there is no need to have a separate book for that. If you are attentive enough in your lectures in your college, and you are making notes of the histology lectures there, then it is still I mean, that's good enough. The point in histology is you need to go into the histology lab and identify those slides, and especially make a note of those identification point, that if you get these slides in the practical exam, how you're going to identify it. And I'm sure there is a part of your first year curriculum in which it is dedicated to how to draw those diagrams. That is very important, because no matter how much you know about the histology, in the exam, the only question you're going to get on the histology is draw the well labeled diagram of so and so. Let's say they will give you the draw the well labeled diagram of the hyaline cartilage. So you have to know that how to use those eosin and hematoxylin color, and how to make those meticulous pictures.
How should standard textbook? Definitely now the students have less tendency to read textbook, but I should say that to have a solid foundation, which I said in the first year and second year subject, reading standard textbook should be a part. This is the time that you will get time. You will get time to read standard book, not later. Like when you're preparing for your NEET PG, you won't get time to read all the standard books. So definitely this is the time that you should read the standard books and try to conclude things from there. Then study materials, if I say that, it is not like the time that when we had nothing as a study material, just the textbook. Not even anybody to guide us how to read the textbook. But now it's not like that. For you, there are lots of people to guide you, faculties, mentors, everybody is there. If you ask anyone, you can contact any one of us in the social media. We are all there to guide you. So study materials, you have n numbers. So you have to particular. For example, Marrow is the gold standard. So if you're sticking on to believe in that study, believe in all of us, and stick on to one. It's like a hunting of sorts. It won't help you. You won't reach anywhere. But reading, with regard to reading standard textbook, I'll say that it should be a part of your journey. Otherwise, that grip, these study materials or whatever videos you're watching, it is like our brain processed. The material is what we are rendering to you. So if you want to process that in your brain also, and to have that solid understanding, then please go through the standard textbook also. And if then you can add on to the main notes that you have made, then it's okay. Just before the exam, notes will be the only source for you. But while preparing, please do read standard textbook. This is my advice to you. With regard to standard textbook and study materials. So I think we can move to the next question.
Yes. Yeah,
Sure.
I think, yeah. Regarding physiology, am I audible, sir? Am I audible,
Yes.
madam? Yes. Regarding physiology, guys, I told you already, you can definitely use the Marrow videos as the sole source for your preparation. I devise those lectures for you only. And one more thing, after I finish every single video, I get a mail from the Marrow background team stating that, sir, you are stating this information, correctness of the information, reference. They periodically cross-check the information, whatever we are giving. That means it is definitely tested everywhere. You don't have to worry about that. These materials are always from the standard textbook. For physiology, you can use the Marrow videos and the notes as the primary source of preparation. I always say the reference books are going to be first and foremost Genome, no doubt about that. And second is Gaitan. These are the two books I always suggest. But there are certain universities, places where the department itself suggests to students to go for certain books. You can also ask your seniors. Why I'm saying this is, be a Roman while you're in Rome. So according to the place where you're studying, your seniors are from the department. Whatever they are suggesting, you can go with that. But finally, I'm a very, very practical person. For physiology, you can rely on the Marrow videos and the notes. That alone is going to be more than sufficient for you.
So could you please continue with this, how to structure my answer in a theory paper?
How should I structure my answers in a theory paper? Particularly being a first year student, if you go into YouTube, guys, perhaps this is the question where you have lot of videos, particularly your seniors make. How should I structure my answer in a theory paper? For physiology, I looked at those videos, the common ones. You will get this information from everywhere. First, write the definition. Second, write the mechanism. Add a flow chart. Compulsorily, mandatorily add a diagram. In the end, finally write a clinical correlation. These are universally given by everyone. Additionally, what you can write is, please write normal values. Physiology is always about the normal values. Wherever possible, please write that normal values. Second additional thing I'm telling you, at the end of one paragraph or small 2 paragraphs, simply write a small summary, 2 to 3 lines. In summary, what you're trying to say in 2 to 3 lines. In a way, this will add bulk to your answer paper. And also, if you write in summary, then definitely examiner don't mind about the repetition of the information. Third additional point I want to say is always try to write integrated information in your answer sheet. Suppose, for example, thyroid gland, anatomy points you can get, biochemistry points you can get. They are no way not relevant to the question. They are totally relevant to the question. You can also add that integrated information in a clinical point of view. When any question asked from anatomy, physiology, or biochemistry, you can definitely write them. So apart from the common ones, please try to write normal values, summary 2 to 3 lines, and also try to add integrated information from anatomy and biochemistry for physiology. No other faculties can give their input.
Uh, uh,
Yes, I totally agree with you, Dr. Krishna Kumar sir, because this is how you should structure. In biochemistry also, there is not much difference from the way that he said. So always write the definition, then if possible, write the concept in the beginning. Then you go to the definition. For example, I'll tell you mostly two types of questions you will get, maybe a metabolic pathway or a clinical question. So I will tell you how to approach these two. So if it's a metabolic pathway, write the concept. For example, glycolysis, if you're writing, then you should write where, when it is occurring. It is in the fed state, in if the insulin glucagon ratio is high. So that should be the first thing. Then the whoever is reading the answer, they understand that you have learned it with an understanding. Then you go to the definition, then draw the diagram with regard to biochemistry. I'll say the metabolic pathway, if you are writing, in NCRT textbook, they are highlighting mostly on the substrate and the product. They're not so much concerned about the enzyme part, because I know when I ask my students, just now I have completed glycolysis in my college, and I asked every step. They are saying every intermediate's pakka clear, they said to me. But when I ask the name of the enzyme, nobody is answering. So that is what I want to tell you. See, when you are here as a first MB student, also as a medical student, what you should concentrate more on is that enzymes. Without the name of the enzyme, that step is irrelevant. So I will say that please do learn the name of the enzyme. So to learn the name of the enzyme, I will suggest that you should see that classification of enzyme, which is a conceptual video I have added in the beginning. That always help you to learn the name of the enzyme with understanding. So this is, and then you can write the energetics, how is it regulated, like that. Then if it's a clinical question, mostly you read the question properly and make a probable diagnosis. At your level, if you are not giving a correct definition, we are not going to cut all the marks. Maybe half mark or 1 mark only will go. So the rest, see the question. See, if you see all the question, you will get a
Ma'am, you're
then
audible.
there will be a question on test or something question will be there in the second and the third. So read all the question properly. Question, you get a lead that what will be the diagnosis. And even if you go wrong, only half or one, not the entire mark. So if you didn't, doesn't mean that at a first year level your entire mark is gone. No, it is not like that. So read the question, always write the then biochemical defect in that, then what are the clinical features, then what are the investigation that you can do, and treatment part, we are not expecting the elaborate treatment part from you, but just the summary of the treatment is what you have to write. So this is with regard to biochemistry questions that is usually coming for exams. Yes,
Apart
Ashwani
from,
sir. Yes.
yes. Apart from what ma'am and sir has recommended, just a couple of things here. In anatomy, as sir and ma'am has already highlighted this, that it's very important that you showcase that how much you know in that. And imagine 150 or badges of 250 also in some certain colleges, and you have to and someone has to check your paper, and they have to go through every question. So it's a task. So it's very important that how you represent your answer. I told in the beginning also that in anatomy, it's very important that you start with the diagram itself. It doesn't matter what the question is. I mean, what are they asking, which area they're asking, whether it's a histology questions or embryology, or because the moment you draw a meticulous diagram in the beginning of the question itself, it creates an impression in the teacher's head that, okay, he or she knows about the topic. Because the moment they look at the diagram and they look at the labeling, which is very easy to kind of gauge quickly, and they will make a kind of, have your impression in the head that this student knows about this topic, and then they're going to enter into the text that you've written after that with that mindset. If you write the stories in the beginning only with no structure, with no highlights, with no underline, with no summary, like sir mentioned, then obviously they have to read every single point, and they're bound to find out those errors which they probably can ignore if the diagram is there in the beginning itself here. So that is one recommendation, that always draw a well labeled, neat and clean schematic line diagram. Nobody is asking you to be a artist in the first year itself. I know that some people have a good drawing, some people can't, but it's a schematic line diagram which we have practiced throughout the app also. and that you have to put in the beginning of the question. Always end the answer with the clinical presentation, whether or not it is asked. In long question, generally they give a separate section for the clinical part of it. In short answers, they don't mention it. Let's say if they ask you a short note on the rotator cuff, they're not asking you about anything about beyond the rotator cuff. But if you write, let's say, a couple of points about the frozen shoulder or something like a shoulder dislocation, it always add to your answer. And if something is lacking in the question, that clinical part will take over on it, and I'm sure that will help you fetch more marks. And one more recommendation is about the histology diagram, which I would say that please always draw the histology diagram in a circle. And there is a reason for that, because in the beginning, the slides that you have, which are epithelium and the cartilages and lymphoids, are still simple. But when you move to the systemic histology, when you have big slides like lungs and livers, you don't know where to stop. I mean, you are just drawing one asanas of the liver, and then you're drawing the second one, third one. You don't know how many to draw. Once you draw a circle, which is like maybe half of the page only that you get, then you kind of limiting yourself. Okay, within this circle, I have to represent every histological feature of the slide. So always draw it in the circle. Please use the HNE, the true HNE pencils. And there's a basic principle about it, that try to label everything toward the right side. If the labeling you can accommodate on one side, then try to label it toward the right side only with the pencil itself. There are certain basic etiquettes which are in the medical curriculum. You have to follow the red for the artery, blue for the vein, green for the lymphatics. So but you have to go with it, because you also need to represent your answer, and you also have to show that you have the respect for all these the etiquettes that we have in answering the questions. So apart from what sir and ma'am has recommended, this is what I would like to tell you about the structuring your answer in anatomy part. So how should I prepare for my Viva?
I prepare for my Viva, and what should I do or avoid during practicals? See, guys, most of the times it is the theory exam which is going to be daunting for all of us, but practical exam, always remember, most of the times the examiners are trying to pause you only. They will always ask you very simple questions, so much of very basic questions. And these days, additionally, the information also came to the faculties that they have to assess your clinical knowledge also. So particularly for practicals, other than basic information, please try to have some important clinical information also with you. For example, if you are doing RBC count, clinically when it increases, clinically when it decreases, like that small clinical information, if you actually answer them, it is very good. So there is no problem in strengthening that. So that answering those small questions come through solving the Marrow QBanks, because QBank has got a lot of clinical information attached with it. So very simple, basic questions only, and always in Viva, please try to answer to the point. You yourself don't go and get caught in telling something and going into unwanted direction. If you don't know, you can straight away directly say, I don't know. Faculties are very kind. They will go to the next question. Rather than getting into trouble, if you don't know, please say don't know. They will ask the next simple question. These are the simple things I want to highlight.
Yes, definitely. And for with regard to Marrow, actually, they have added that practical modules this year. No, I have just gone through it, and I find that it is very useful for your last minute preparation for your practical exam. Don't be too much, worried about the practicals now, because whatever you learn in theory and clinical, in the theory exam is what is in an applied way asked in Viva. So it is nothing else. Only thing is that there are some experiments that you have to do. For example, abnormal urine, normal urine, then some estimations. Then you have to identify certain instruments. And in the new pattern of exams, you will get some question on communication skills as well. So where you have to counsel the patient to collect 24-hour urine sample, how to counsel the patient before you take a blood sample for glucometer, etc. These segments has been added, like objective structured practical examination. This has been added with the new CBME curriculum. So don't worry about all those things. So when all the theory exams are over, then the faculties will definitely prepare you for that also. And the practical modules is actually a game changer in that aspect, because they will give you a quick learning through almost every topics that you are going to get in the practicals. Plus, that hand skills always matter for every subject. For physio as well as biochemistry. And with the new advent of the new pattern of exam, I'll say that, previously the faculties used to ask, we divide the theory into four segments, and the four examiners are there to ask you many questions. So in that aspect, they can ask from anywhere. Maybe it is a basic core biochemistry topic they are going to ask. But now it is not like that. They have a set of charts with them, or a set of instruments with them. So just showing you that chart, they are going to ask you the question. So all the charts are prepared in such a way that they are going to ask only applied aspect, because practical Viva is usually a part of a practical exam. So that is the whole point. That is, they want to assess your practical knowledge rather than your theory knowledge. So definitely, once you see all the, once you understand all the theory, the applied aspect will usually, spontaneously it will come to you. And they have a set of charts with them. So just be calm and don't think too much about practicals now. Once the theory portions are over, the practicals will be very easy for you. That is what I want to advise with regard to Viva. Yes, sir.
Yeah. When should I start solving QBank modules, and are they important for your university exams? The answer is definitely a big yes. Very, 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 very big yes. They are definitely going to be very helpful, because we all know it's an open secret that your exams, university exams, have multiple choice questions. So definitely they are carrying marks, and it is very easy to pass if you get a good mark in your MCQs. So, on the best thing to do QBank, when to do that, sir? Suppose, for example, you do any particular topic, a skeletal muscle contraction, there is one video. Immediately after that video, please do the QBank. If you finish a topic, then immediately after the topic video lecture, you do the QBank. And QBank, I already told you, it is a teacher, it is not a test. Any additional information you get from the QBank, please write in the notes and strengthen your notes. Please don't try to write everything given in the question bank. The most important ones, please try to add in your notes. That's how you collectively learn. You do one topic, at the end of the topic, please do the corresponding question bank for that and revise that, add them in your notes. Finally, make it complete. That's the best thing I always want to say you. At the end of one topic, please do a QBank.
Yes, and moreover, every university exam, 20%, 20, that is in 100 marks, 20 marks is for MCQs. So for your MCQ answering will give you a huge chunk of mark. Actually, in a 200, we have two papers. For every subject, we have two papers. So totally there you are getting 40 marks from MCQs itself, which means that it is a huge mark that you are getting from MCQ. So for that MCQ preparation, definitely QBanks are going to help you in a very good way. Yes, sir.
Those are the questions which we got in the bulk from the team, and so I hope that we have answered them satisfactorily to everyone. We can take some questions from the live chat itself. So there are some people who have been messaging in between. So I think this is the time that you can kind of put forward your questions, and we'll try to answer them. We also have
in the comment section also, I saw many of the students asking, I'm a FMG student, can I use this in first year? Of course, yes. There is no doubt at all, friends. It is going to be most useful for you, perhaps. I'm really telling you, if you're an FMG student, particularly first year, there is no doubt you should definitely use this Marrow videos for your preparation.
We also have Dr. Abbas in the chat. So, sir, we are preparing your students so that we can send them prepared to you when they reach final year to read the orthopedics. Dr. Abbas is our ortho faculty. Guys, please pour in your questions, and we'll be very happy to answer them. I failed in anatomy in my first year, currently in odd batch. How to make the structure plan? I'm stuck. I guess what ma'am told is very important in this, that knowing that what is, every university is having a basic set pattern of questions which are being asked. So it's very important for you that if you're in an odd batch, to find out that what are the questions which are being asked in the last 5 years, and you work mainly on them, because there's a practice that every university is having a set questions which they generally like to give them again and again, and especially the long questions. So I would say that apart from obviously preparing and revising, you probably need to go to the previous year questions of your particular university and work on them. And I guess that probably would help you get out of this odd batch thing.
Yes. There is one question: how to manage Marrow videos and college time? Perhaps very good question. It's very simple, friends. Suppose any topic, if they teach you in the medical college, they have a preformed timetable. All teachers have that. According to that, they move into the lecture. So whichever lecture they cover in that day, please come and read that same lecture the same day from the Marrow. That will be helpful. And one more question: when to revise, how to revise? Very simple. Suppose if yesterday you are reading one topic, today for 10 minutes, revise the topic. At the end of 1 week, whatever you read in that entire week, please revise for 30 minutes. That's a very simple logic. Yesterday's topic, today, 5 to 10 minutes you revise. For the whole week, at the end of that week, revise for 30 minutes. It will stick into your long-term memory.
One question I have seen is it mandatory that I draw images for all the questions in theory paper? So if you ask this question to me, I'll say that, I'm very poor in drawing, but still I try my best to draw anything, at least a flow chart, or in my own way I used to draw diagrams in every answers, because in first year I couldn't understand this is the technique to make marks. But later years only I understood that to get marks, always better is to add an image or a flow chart or a diagrammatic representation rather than writing everything in paragraphs. So I will say that even if you are not good at drawing, please draw in your own way. We teachers can understand you. Anyway, there are teachers like me also who don't know to draw. So definitely there are many people who can understand your state. So definitely, whether it is good or not, it's neat or not, please draw images. It should be a part of every answers.
Thank you, Dr. Abbas. He's helping us enormously in answering these questions. People, please follow the chat box. Our at the Bone teacher is our ortho faculty, and he's answering.
Sir, can you guide, like, time management is very frequently asked question, I think.
Sir, would you like to, Krishna sir, because you're audible to ma'am, so please.
Yes. In the main live session also, we covered many aspects regarding the time management. It is always good to study every single day. And next important thing, please don't have the mindset like everything is getting piled up. More and more will get piled up. So don't have that mindset. Always have the mindset, it is going to be easy for me, I will definitely do that. Once you have that mindset, automatically you will start reading every single day. It is always about the plan, as I always give this T20 example. So if you have 200 runs, every over maintaining that run rate, that is the team which is eventually going to win. That last moment, most of the times that strategy will backfire. So please try to read every single day. So in the morning itself, you plan for your day. While coming in the evening, these are all the things I'm going to do. This micro planning will help you. So please read every single day, all 3 subjects.
And this is I think backlog is a part and parcel of MBBS only. You will not have a day that when you not have a backlog. So backlog will be there for sure.
Yes, one question that we are getting is how to make notes. So with regard to how to make notes, I will say that, if you ask me about images, I'm very poor. But if you ask me about making notes, I'm very good. So there is always somebody who are very strong in making notes, and there are people who are not very strong in making notes. I would say that, if you are not if you are not getting the crux of how to make the notes, there is always somebody else, a friend of you will be there to help you. So try to learn from them. So try to learn how they have written their notes and try to incorporate some knowledge from them also. Then you will definitely improve. It's not like a matter that you are going to the very perfection level. But if you read through the textbook and make the notes, you should have, first what you should do is that you should have that understanding of what are the headings and subheadings. So to make the headings and subheadings, I will say that the curriculum is the best study material or the best reference material material to you, because in curriculum it is given all which are all the objectives. So that objectives will guide you like what to make in the notes. Rather than writing every sentence in the textbook, you see the objectives of every competency and then you have to make a notes. For example, if I say that any pathway, if I'm saying biochemistry, I can say that in biochemistry, if a pathway, if I'm making a note, you should have the subheadings with you. For example, that's what I said, definition. Krishna Kumar sir, Ashwani sir, everybody said what are the headings and the subheadings that you expect in under every question. This is what you have to make into a notes. This is a simple step that I should give you, that you make the headings and the subheadings and you fill in it. That is how you can make a notes, and try to explain it in a flow chart rather than writing it in a paragraph.
Bone teacher is our savior. I think most of the questions sir is answering in a beautiful way. You can see those comments also, dear friends. Yeah.
Okay. So I think so we have answered most of, like,
Yes.
collectively. Dr. Abbas has answered more questions than we all three collectively. So thank you, sir.
Even then, this video will be there in the YouTube. In the below comment section, they can put whatever their queries. Whenever we see them, we'll address them, sir. So it's a dynamic live session. It will not end here. So all of your queries you can put there also. We'll see and we'll definitely respond.